We want to review with you the instructions for our patients in the pre-op and post-op ProPeel system. They've had their peel using solution 1, 2, 3, and 4, and then right after the peel, they're leaving the skin alone until the next day they start using their moisturizers and sunscreens. They begin to peel on like the second day across the face like a wave, and then at the end of a week it's done, but they have brand new skin. So we want to make sure during this period that they know exactly what's going on, so they won't plan to go to the beach, or they won't have a special wedding coming up or reception during this length of time. So we put together our little ProPeel questions and answers for you to review with your client. First is a little brochure. What is a ProPeel? So it goes over the common questions. How does a ProPeel work? Can I wear makeup after the ProPeel? Can I go in the sun after a ProPeel? And how does can I use it if I've been on Accutane or pregnant? So it answers all their common questions on this brochure they get right away when they first come in. Once they decide they're going to do it, then we got to make sure that they follow their pre-op, post-op instructions. So this is what we call the pre-ProPeel checklist. You want to see if they've been using Retin A or one of our vitamin A conditioning lotions like X-Full-A, or they've been using like a bleaching lotion like hydroquinone, or they've been using kojic acid or other peelers. They should be on a preconditioning program, but we should know what it is. We want a little light peeling once a week to know they're at the right level and to know they'll heal quickly after their ProPeel. If they're not peeling at all, we want to boost it up. If they're peeling too much, we want to let the skin calm down before we add the ProPeel to our program. We also really want to know, importantly, if they have any fever blisters. If they get a cold sore fever blister every month, we want to make sure we don't peel around the mouth, or they have a prescription for antiviral from their doctor. So right after the ProPeel, they can take their antiviral medicines. Our little rule of thumb is if they get fever and malaise at day 5, it might be a herpes. We want to avoid that by knowing that they have a problem, get them on antiviral medicine. So that's important in their pre-ProPeel checklist. We also want to know they have their instructions, so they know exactly what's going on in their home care kit. We want to remind them, our little 5 reminders, that they come to the office without makeup or without earrings. We're going to be peeling their face with the cotton gauze. We don't want to get it caught in their earring and delay our ProPeel. We want to make sure they have a quiet week after the ProPeel. We don't want to do a peel and all of a sudden they're flying to New York for a special show the next day. So make sure they have a quiet week. They want to wear comfortable clothing. We may end up doing a peel in the décolleté area. We want to have a shirt that opens in the front where we can do a nice peel from the décolleté to the hairline. We want to make sure they have their contact lenses out. So 2 things are important there. One, the lenses are out, and the other is they brought their glasses so they can drive home. So they need to have the lenses out. We don't want to be peeling with the lenses in, because if we did get a drop in the eye, we don't want to get under the lens and causing a problem. The other, number 5, the big one, is they don't pick or scratch their skin. Some people have habitual picking habits, and we want to make sure that's under control before we get into one of our peels. The day of the ProPeel checklist, that day, we've already gone over the pre-peel. Now we want to do the day. Same type of questions. Was there an informed consent sign? If they have a history of herpes, are they on antivirals? Have their photos been taken so we have a record? Do they have that quiet week coming up? Do they have any questions regarding their ProPeel? Have they gone through and answered everything? We don't want them to have any questions. Remove their contact lenses and earrings, their post-care instructions, and their kit to take home. Lastly, we remind them of the 3 things: no picking, avoid sunlight, and call the office if they have any questions. We want to make sure they have a phone number for us. They can give us a ring, because afterwards, quite often, they think of something new. And we also schedule their recheck and their facial treatment, like in day 3. We'll often get them back in for a Prozyme facial to get the scale off, so we will make an appointment for that. Important is their informed consent. This is a document that we've generated over the years, which we try to explain to them what's going on. So it tells them with the application of the peel, it may tingle and sting. My wife calls it hot peppers. And some people sting a little bit, some people sting a lot. And they hold a fan to control that. But they should know it's going to be some stinging. They may look worse. It says here they may temporarily look worse because all that peeling is going to look uncomfortable. If they have acne, it might flare up. If they're blotchy brown, it might get temporarily darker. They should know that before they go in and sign it on their informed consent. Then we tell them about sunburn. Once that new skin is there, they may burn. So we want to make sure they stay out of the sun, wear their sunscreen for like 10 days after the procedure. Again, we review now for the third time about their fever blisters or herpes to make sure we know if there's a problem and they're on antivirals. We want to make sure that they've been informed, they agree to follow the directions and instructions. You should know your patient by this point. If you brought them on their conditioning program, done microdermabrasions, done glycolic peels, you know if they're good patients at this point. If they're not good patients, learn to say no. Avoid the complications by just saying, honey, you're not really for us. We recommend you stay on your kit, stay on your home care program. This is our home care kit, and it reviews everything with them. We want to make sure they're using non-allergic, non-comedogenic or acne-producing or non-irritating medications for the 10 days after, because that new skin is susceptible, and we want to be very careful what goes on it. So it tells them like what to do. Immediately after the peel, day one, they don't do anything. They have all the stage 4 of our ProPeel, the high-dose retinoid on. They look a little bit yellow, but they just leave it there. Because if they put like a heavy ointment on, like a triple antibiotic ointment, they can hydrate the skin again and get further penetration of the chemicals. So they go home, do nothing. That night they wash it off with our cleansing milk. The next day they start the cleansing milk, and then they wear a moisturizer in the morning and moisturizer at night. Use the cleansing milk twice a day. As they move along and begin to peel, they can add to their cleansing milk the buffing grains and do a little buff to get the dead skin cells off. Then cut off any excessive peel so they can wear their makeup. We don't want them to pull it, because if they pull it, they may pull it into an area that's not ready and get reactive hyperpigmentation or get an infection. So if it's sticking up and they can't wear their makeup, they just take a pair of cuticle scissors and cut off the peel and then put on their moisturizers. By day 10, day 6 to 10, they're pretty recovered. They want to continue on out of the sun, wearing their day treatment moisturizer, which is high in zinc, to reduce the inflammation. If they have a history of blotchy brown, we use the day treatment in the day, and around 1 week or day 7, we start the bleaching cream, the 222 cream, to avoid any recurrence of their blotchy brown. So, in summary, they're going to do nothing the first day, then they're going to start moisturizing, and then gradually go back onto their skincare program and add the bleaching cream 222 if they tend to be blotchy brown, and then maybe schedule a repeat ProPeel in a month. They may end up with 3 or 4 a year. Every time they look at their complexion, if it can be improved, they could have another ProPeel. So by combining it all together, we start getting the step-by-step skin rejuvenation completed and get them rejuvenated and looking 29 and holding. So thank you very much. And any questions, please let us know.